It is 10 o'clock and I am going to respect your time. So good morning again. My name is Brittany Frazier and I will be facilitating this webinar this morning. So welcome to the Allegheny Franciscan Ministries Tile Grant Information Session for fiscal year 21, cycle 1. Carly, did you begin recording? Perfect. Okay. Okay, so for today's agenda, I will go over a reflection. You will watch a very brief video about Allegheny Franciscan Ministries and our history. We will do introductions by way of a poll. I will go over the social determinants of health framework, go over our tile grant process and timeline, and answer questions that you may have. So Carla, who is assisting me with filtering through the questions in our chat box. So as I present, if you have any questions, feel free to write them in the chat box and I will check back in with Carla every few slides or so to address any questions that you have. If you have any project-based questions, I ask that you set some time aside to speak with me to discuss your projects. Okay. So here at Allegheny Franciscan Ministries, for those of you who are new to the organization, we are a Catholic organization and we like to begin all of our presentations, our meetings, our convenings with a reflection or a prayer. So I ask that you join me in silence as I read this reflection. Prayer for our nation. God, we come before you asking for mercy on this land. We seek your forgiveness for racial injustice, trivial divisions, and the shedding of innocent blood. Help us amend our ways and our deeds to follow your will by exercising your love towards one another. We pray for an awakening of peace, spiritual revival, renewal throughout America. We turn our lives over to you and we humble ask for your healing on our land. Amen. And just an FYI, this webinar will be recorded. So if you wanted to look back at it at a later date, this webinar will be linked on our website in the next few days. So the vision here at Allegheny Franciscan Ministries is to serve together in the spirit of the gospel as a compassionate and transforming healing presence within our communities. And what you see here are a couple of pictures from a few of our staff members and our council members out in community, actually living to the mission of our organization. And we are guided by this mission and rooted in the tradition and vision of the Franciscan Sisters of Allegheny. Our core values are stewardship, reverence, justice, safety, commitment to those who are poor, and integrity. So without further ado, I am going to debut our video. So give me 1 second. Carla, can you hear that? 1 second.
I'm Margaret Mary Kimmins, OSF, Order of St. Francis. I'm the Congregational Minister of the Franciscan Sisters of Allegheny, New York, and I come initially from Brooklyn. Brooklyn. At one time in our history, when we were started in 1859, we did everything. If there was a hospital to run, we ran it. If there was a school built, we, with a principal, we did everything. As we continue to develop, we've gone into other ministries because our founder said to us, respond to the needs of the people.
Allegheny Franciscan Ministries works in communities in Florida to improve the health of the community. We do that through making grants to nonprofit organizations who provide access to health care or health information, or who work on systems that impact people's health. We also work directly in the community, bringing people together to talk about and organize around issues related to people's health. The sisters sold St. Francis Hospital in Miami and sold St. Mary's Hospital in West Palm Beach. And then here in the Tampa Bay area, St. Joseph's Hospital and St. Anthony's Hospital merged with others to form BayCare. Through all of those transactions, funds were set aside to create Allegheny Franciscan Ministries.
The entirety of AFM, I think, is a testament to the great work of the Franciscan Sisters of Allegheny. Their vision of healthcare that they had provided to those communities and how important that was to those communities, but also recognizing when it was time to transition and to do something different in those communities.
To me, the idea is that we're building a partnership for the future, that we're handing on our legacy by training others and saying, this is how you carry on the ministry, this is how you work with people. You form partnerships, you bring dignity to them, you bring integrity. And so therefore, the mission, the charism, the spirit that we had, hopefully, will get passed on to others, and lay people will carry that on. We have already said to our board members, you are the people for the future for us. We're trying to train you and show you how our mission works, and we're asking you to carry that on.
Allegheny Franciscan Ministries approaches health from a very holistic perspective. We look at health from a social perspective, a behavioral perspective, from the environment, and from all the systems that impacts people's health. The Franciscan Sisters of Allegheny really give us the courage and the drive to do what's right in the world, to make sure that people who may not have a voice are given a voice, to make sure that people who may not have access to health care, to health information, to health resources have that access.
AFM is the future embodiment of what the Franciscan Sisters are all about. And it gives them the opportunity to do the things that they've always done and that they've always wanted to do. For them, it really is the organization for their future.
AFM is significant to our mission, so significant, integral to our mission. It's what we would do if we could. I know when I thank them, I get emotional because we're just so grateful to have Allegheny Franciscan Ministry to continue our mission and our charism, that whole different way of doing things.
You know, I've used the word courage a lot, and that's one of the charisms of the Franciscan Sisters of Allegheny. It is what they are. And I like to think that Allegheny Franciscan Ministries is a courageous organization in really trying to make sure that we aren't sitting on our laurels, that we are really looking to be the best that we can be, to take risks, to try the next thing. And if that's courage, then that's what we should be doing.
All right, so I get so excited every time I watch that video. So for those of you who are interested in watching that video or any other videos that we have, please feel welcome to go to our YouTube page. We do have a YouTube page. And in the search box, you can simply type in Allegheny Franciscan Ministries, and you can watch that history video that we have. We have videos from our Common Good Initiative, our fellowship program. So please go ahead and watch that video. So moving right along to introductions. And I see that there's a question in the chat box. I would take that shortly if it's for me, Carla. But as you can see here, we have some very funny pictures, some caricatures of our staff team. So last year, our CEO decided that this would be a really good team building activity to get our pictures drawn at our staff meeting. So this is how I'm going to introduce our staff team. So as I mentioned before, I am Brittany Frazier, and I am the Public Health Program Specialist here at Allegheny, located in our Tampa Bay area. Carla Batts, who is assisting me today, thank you so much. She is our Community Investment Specialist, and she is also located in the Tampa Bay area. Daniel Gibson is our Regional Vice President in Miami-Dade County. Eileen Coogan is our President and CEO. Erin Baird is our Director of Grants, and she has been with the organization for 20 years. Kathy Hardy is serving as our Grants and Administrative Coordinator. Lise Landry Olives is our VP of Operations. And last, and certainly not least, is Upendo Shabazz. And she serves as our Regional Vice President for Palm Beach County, St. Lucie County, and Martin County. So before we move on to the next slide, we are going to administer some polls to just kind of feel who's in the room, which region you are serving. So Carla, can you go ahead and debut the polls, please?
Okay, I'm going to go ahead and launch the poll now.
Okay. All right, so the first question is, has your organization applied for a TAL grant in the past? And your choices are yes, and you have received funding before, yes, but you did not receive funding, or no, you are new to the organization. And if so, welcome. So I'm just going to give you a few seconds to answer that first question.
Looks like we have about 83% of responded so far.
Okay. Are we still at 83?
We're about 90 now.
Okay.
So whenever you're ready.
I'll give it 5 more seconds. Okay, let's look at the results. All right, so majority of you are returning back and you have received funding in the past. So that's good to hear. 12% of you have applied before, but you never received funding. And then 42% of you, this is your first time applying for a TAL grant. So again, welcome. And we look forward to building a relationship with you, regardless if you get funded or not. So let's move along to the second question.
Okay, we'll go ahead and launch it now.
All right. So what region do you serve? Are you in Miami-Dade County? Are you serving the Palm Beach region, or are you in Tampa Bay? And we do know that some of our organizations that we do fund serve all 3 areas. So let us know which region you are serving.
Right, we're about at 93%, 94.
Okay, we can reveal the results. All right. Wow, I'm not surprised about Tampa Bay. So we have 49% of our organizations are in the Tampa Bay area, 34 in Palm Beach, and 17 in Miami. We have to do a better job at doing some outreach in Miami-Dade County for sure. But again, welcome to all of you who are returning, who are new to Allegheny Franciscan Ministries, and we look forward to being your partner. So before I move forward, thank you so much, Carla. Do we have any questions in the chat box, or are we good to go?
We do have one question that already came up. We're a fiscal sponsor for an agency who is interested in applying for funding. Which budget needs to be under 2 million? The agency applying or the agency implementing the program?
So that would be the agency implementing the program. Thanks for that question. All right, so moving along. So let's go over what you're here for. So our TAL grant overview. So this particular grant program is intended for smaller nonprofits with an operating budget of $2 million or less. We do have other grant programs, but specifically for this grant program, we are here to serve smaller nonprofits. The funding request is up to $10,000. You are more than welcome to request less than that, but funding request is up to $10,000. And this particular grant program has 2 cycles. So as I mentioned before, we are currently in fiscal year 20, and for us, that begins in July 1st to be exact. So we typically will have a cycle in the fall, which is now, and then we'll have a cycle in the springtime, which applications are usually available in January. And the deadline for this cycle is September 17th, which is a Thursday at 12 p.m. noon. So you guys have 1 month, 4 weeks exact, to complete this TAL grant application. And for this cycle, we are focusing on capacity building for organizations or programs within the organization. And you must address at least one of the social determinants of health. So I do want to backtrack. So as an organization just asked a question about fiscal agents, typically we don't award or don't, it gets challenging to work with fiscal agents. But if there's an organization we are willing to consider, but they are in the process of becoming a 501c3, but they have a fiscal agent, we may work something out if you are up for consideration. And also in the past, we know that some organizations, their budgets are tied to a regional organization or a national organization. Again, if we are considering you for funding, we would ask for those additional documentations just to ensure that you are have an operating budget at $2 million or less. Carla, I did see a few highlights. Do we have chat questions?
Nope.
Okay, good to go.
We're good.
All right. All right, so in order to be eligible for our TAL grant, you must be a 501c3. I know I just mentioned we do allow fiscal agents. That is very rare, but if you are in the process of becoming a 501c3 and we're interested in your grant application, we will work something out with you. But usually we only work with 501c3 organizations. And you must be serving residents in one of our 3 regions: Hillsborough County, Pinellas County, Martin County, St. Lucie County, Palm Beach, or Miami-Dade County. I also want to let you know, for example, we do have organizations in the Tampa Bay area, because Tampa Bay can mean something different depending on who you're speaking to. So I know that Allegheny primarily serves Hillsborough and Pinellas County, but if you do serve a pocket of Pasco County or a pocket of Manatee County, we will consider you for funding, but primarily you have to serve residents in Hillsborough or Pinellas County. And you must be in good standing with Allegheny Franciscan Ministries. So this bullet point is geared towards folks who have received funding in the past. And honestly, at this point, you would know if you're not in good standing with the organization. But you must close out your grant on time and things of that nature. But if you are new to the organization, this bullet point does not apply to you. And last but not least, you must be willing to comply with our requirements within our grant agreement that we will provide to you if you are moving forward to the next round. So what are the limitations? As we mentioned before, your budget cannot exceed $2 million. If you have received a TAL grant recently, we do discourage those folks for applying because we like to spread the wealth and build relationships with new partners. But last fiscal year, we did have a special initiative where we focus on the 2020 census and voter engagement. So if you are an organization that received funding for 2020 census outreach or voter engagement, you are welcome to apply for this cycle, because we know that last fiscal year was a special initiative to corral folks to complete the 2020 census and voter engagement. And for those of you who are on this webinar, I hope you have completed your 2020 census. All right, so this funding opportunity is not available for an individual, any public or government agencies, capital projects, fundraising events, or endowments. You may not receive or have more than one active TAL grant. So organizations, as I mentioned before, we do have a few partners who serve in all 3 regions. You guys are welcome to apply or submit an application in all 3 regions, but you won't get funded for all 3 regions. So again, I don't recall any organizations currently having a TAL grant open unless you did a 2020 census or voter education, voter engagement. So you're more than welcome to apply for a TAL grant this cycle. Requests may include personnel costs, but we're asking that you do not submit an application strictly or 100% for salary, but you are more than welcome to request funding for personnel if you need assistance with a staff member or anything like that. And our TAL grant program is not intended for ongoing, sustaining projects. This is a one-time thing to help with capacity building needs. So what is capacity building? So by definition, capacity building is something that is intentional, mission-driven efforts aimed at strengthening the operations, your management, a program, and governance of a nonprofit to ultimately improve the performance or the impact. So in layman's terms, we just want to help our partners get to the next level. We want to make sure that our partners are making a great impact in their communities. So we will provide some examples of what capacity building look like, but we also know that we are not the experts. You guys are the experts. So just because we may list a few examples of what capacity building is, that does not mean you guys are confined to the list that we have provided. So here are some examples of what capacity building can be for your organization. So we have technology equipment or software, strategic planning, fundraising strategy or fund development strategy, board development or staff development, any type of DEI work, diversity, equity, and inclusion training, or social justice training. And then we have website redesign, marketing, and communications. As you notice, 2 of the bullet points are bolded. So we are giving priority to organizations who are requesting funding for technology equipment or software or any type of DEI work or social justice training. And the reason being is because we know that with the current climate, a lot of organizations have a transition to virtual work or remote work. And we know that a lot of them may need to update some of their technology equipment or even just purchase new technology equipment or update their software for security purposes, perhaps. And also with the climate that we're in, we know that a lot of organizations are interested in doing some DEI work or any type of social justice training. We are considering applications that may need strategic planning. So we're not saying that every organization that will be funded will be a technology type of project. And you're also encouraged to apply for funding for multiple things if you need it. So for example, if you needed to purchase 5 new laptops, you needed some funding for a particular staff member, and you needed to update your website. If all of that is under $10,000, you are more than welcome to apply for funding for multiple things. And as I mentioned before, you are not confined to what we have listed here. So if your organization has a particular capacity building need, I would encourage you to reach out to me so we can have that discussion. Again, we're not the experts, you guys are, so there may be things that your organization may need in order to get to the next level. So Carla, do we have any questions about capacity building before I move on?
We have a few questions, yes, that have come in on a few different things.
Okay.
So one is an organization able to do a joint grant with another agency with a similar mission?
That is a really good question. So typically, we don't have organizations like that. So as I mentioned, last fiscal year, we did have a special initiative where organizations who were doing 2020 census efforts, they did collaborate together. So it's not a definite no. It sounds really interesting. So I would definitely encourage you to reach out to me so we can have a deeper conversation about that. But we are open to that idea.
Okay, the next one is, and you may have just answered some of this, but could this grant be used to fund an audited financial statement for a nonprofit organization that meets all other criteria?
Yep.
Okay, let me see. Due to COVID, some of the software had to be purchased quickly. Can this grant cover major software expenses already incurred in 2020?
No, but again, reach out to me so that I can process and digest that. But my immediate answer is no, but reach back out to me.
And then is new website development eligible?
Yep.
Okay.
Yep. And I also want, Carla, were you done? I'm sorry.
There's just one, you probably are going to touch on this with social determinants of health, but defining social determinants.
Okay.
Slides.
Yeah,
Okay.
I would definitely touch base on that. And I also want to mention too, so I know this is useful information. This is also listed on our overview page on our website, but we are intending to fund up to 5 organizations at a max of $50,000. So $10,000 per organization per region. So we're expecting to fund 5 organizations in the Tampa Bay area, which includes Hillsborough and Pinellas County. We're expecting to fund up to 5 organizations in Miami-Dade County alone, and then 5 organizations in the Palm Beach region, which includes Palm Beach County, St. Lucie County, and Martin County. If there are organizations that do not request up to $10,000 and we're considering them for funding, we may have a little bit more money left in a pot to fund maybe a 6th organization. But if all the organizations are requesting up to $10,000, then the goal is to fund up to 5 organizations per region, totaling 15 organizations that will be funded for this cycle. Okay, so I'm moving on. All right, so this is the juicy stuff. I enjoy public health work. Prior to working at Allegheny, I worked at the health department. So I'm all about public health. I'm all about social determinants of health. So I get excited when I have to present on social determinants of health. So what is social determinants of health? It is a term that is widely used in the public health sector. And we know that a lot of organizations who do not work in public health, believe it or not, the work that you do does tied and bleed over to public health work. So public health or social determinants of health are social, economic, and physical conditions that influence a person's overall health status. And some examples of that can be housing, access to healthy food, quality education, job training, transportation, and having access to health care. And we also know that vulnerable populations that may be impacted by this, they are faced with a lot of health inequities and health disparities because of structural racism, historical disenfranchisement, and discriminations. So as we move along in this presentation, I just want you to keep that in the back of your head, that yes, we are impacting and addressing the social determinants of health, but we want to make sure that we are providing programs and services to those who are truly marginalized and who may have been impacted and oppressed by racism or discrimination or disenfranchisement. So just keep that in mind. So here at Allegheny, we are using the framework that has been created by Healthy People 2020. And they have created a framework that includes 5 general categories. And there are multiple frameworks that are out there in the public health sector, but this is the one that we are using. And we are also mindful that Healthy People 2020 is in the process of updating their objectives and their topics and their frameworks for 2030 for the next decade. So this information may not be relevant in the near future, but for today, we're going to use this framework. So the 5 categories that are listed before you is neighborhood and built environment, and I will go a little bit more into detail about each category. So we have neighborhood and built environment, we have health and healthcare, social and community context, education, and economic stability. So as I mentioned before, a lot of organizations may not think what they do is health related, but it is. If you're working with folks trying to provide them with different job training opportunities, that ultimately does impact their health. So Carla, do I have questions before I dive into this, or are we good?
I do have one. I'm not sure if this person, you would need to maybe talk offline. It's a little more project specific. Would you consider grant proposal writing training and or hiring a proposal writer as capacity building?
That is considered capacity building for sure. All right.
Great,
so
thanks.
the social determinants of health. So as I mentioned before, there are 5 categories that we are considering. So I'm going to try to give you an example of an organization that may fall under this category in addition to a capacity building need that the organization may need. Again, these are examples. I may name out an organization. That doesn't mean this organization will be considered for funding, but it's an organization that may come up off the top of my head. So let's give it a try. So for education, the bullet points we have listed is high school graduation, enrollment to higher education, and early childhood development. And these are just some examples, and I do have resources listed at the end of this presentation where you can go and do some research on your own. So an organization that may fall under this category can be an organization that typically will go into the schools and provide social, emotional learning trainings for students in middle school, right? But now with COVID happening, we know that a lot of our students are not returning back into the school system and they're doing home learning. So an organization that typically will go into the school, but now they have to pivot and do things virtually. This organization may request funding for new technology. So now that they can better engage their students, being that they're working from home, or that the organization can't simply go into the school anymore. So again, an example for education is an organization that provides program within a school system, but unfortunately due to COVID, they are unable to go into the school, but now they need new laptops or new software in order to provide the services that they would typically provide. So that would be an example for education. For economic stability, this can be an organization that provides housing to the homeless population. The homeless population is definitely a vulnerable population, and they need housing too. So this can be an organization that is assisting folks trying to obtain housing, and they may need help with marketing. They may need to update their website just to let people know that they are out in the community, that they're providing these type of services. So again, an organization that helps folks get housing. They need to do some marketing updates just to let the community know that they are here to assist those with housing needs. An example of health and healthcare can be a dental clinic. I've read a few articles via social media and even spoke to one of our grant partners. I know of a lot of our dental clinics are faced with providing PPE costs. They didn't necessarily include that in their line item, their budget for the fiscal year, but due to COVID, they have to cover PPE costs. So a dental clinic who provides services to folks that live in economically distressed communities, they may provide free dental care to folks but they need funding for supplies and equipment, specifically for PPE. So that could be an example of an organization that may apply for funding for this fiscal year. Neighborhood and built environment. The first organization I thought of was POW, which stands for Police Athletic League. And typically their mission may be to decrease crime and violence in certain zip codes and certain communities. So POW can apply for funding, and they typically do provide after-school programming, helping students with school or just social and community context type of work. So actually they can fall under both social determinants of health categories, but as it pertains to neighborhood and built environment, their mission is to decrease crime and violence in high crime communities, but they want to assist students with homework because, let's face it, a lot of parents don't have the time to help their kids doing homework because maybe they're working more hours due to COVID. So POW may submit an application for new technology to help the students with their homework, knowing that their parents are unable to do so. And an example for social and community context can be an organization that assists folks who are re-entering communities. So say they were incarcerated, they were in jail, they were in prison, they are re-entering community, but they need assistance with wraparound service in general. So this organization may request funding, one, maybe for personnel staff to assist these folks who are re-entering community. Two, they may need to do some social justice training or maybe some DEI work. So that's an example of an organization that may fall under that category. Again, these are just examples. I hope that you were able to digest and process this information. Again, this is recorded, so if you need to look back on this, you will be able to do so. And as I mentioned before, I will be providing some resources for you to just do your own homework to learn a little bit more about the social determinants of health and the framework that we are using here at Allegheny. So before I move forward, Carla, I'm going to tap in to see if we have any questions.
Great, thanks, Brittany. Yes, we do have a few others that have come in. Would training to gain certification as a trauma-informed care provider fit into this grant?
Yep, that is capacity building. And again, as I stated before, we just list generic examples, but I can totally see how that may help your organization get to the next level. So yep, we will consider that as capacity building.
Is mental health considered healthcare to Allegheny Franciscan Ministries?
It is, and I'm also interested in learning what exactly are you requesting funding for. And just to be transparent, mental health is something new that we are stepping into. We definitely support it, and we know that that is definitely a need in many communities. So I would encourage you to apply, but I would also encourage you to reach out to me because I'm just interested in learning a little bit more about that.
Brittany, you mentioned this earlier, but if you can just reiterate, can an organization submit more than one application?
Yes, so you can submit more than one application in a different region. So you can't submit 3 applications in the Tampa Bay area, but you're more than welcome to submit an application in Palm Beach, Miami-Dade, and Tampa Bay if you are truly serving those communities. And to be frank with you, you won't receive funding in each community, but you're more than welcome to do that.
Great. If an organization has impact under 2 categories of social determinants, does that have greater chance of grant approval?
Great question. So no, but depending on the other applicants that may come through, because again, we don't know who's applying. We don't know which applications may be a little bit more compelling. We don't know what the immediate needs are, in the community in comparison to what other folks are applying for. So no one particular category will get you a better score than another category. So that was a really great question.
This one's kind of along the same lines. Can the program be a cross-cutting one and cover more than one of these areas?
Yeah, absolutely. So when you are submitting the application, there is a question, and I will go over that shortly. there's a multiple choice question for you to choose which category you fall under. As I stated before, I know that many organizations may address some of these factors or all of those factors, but we ask for you to consider which factor resonates with you the most for this cycle or for whichever project you're applying for.
Great, thanks, Brittany. All right, we can go ahead and move
All
forward.
right, great. So how to access our online application. So for those of you who are familiar with us, it is the same process. But for those of you who are new, again, welcome. So in order to access our online application, and everything is online, we do not accept any paper documents, don't mail anything to us, don't email anything to me. Everything is strictly online. So you can go to our website at afmfl.org. You can do a quick Google search and we should pop up. And once you go to our website, at the upper right-hand corner, as you can see, circle is the login button, and there's a drop-down menu. So if I can recall, there's volunteer applicant, and then there's grant partner applicant. You're going to choose the second option. And once you do that, you will be brought to this page. Again, if you have an account with us and your information is already pre-logged in, you will simply log in. If you are new, you will create a new account. And if you need any help with creating an account, you're more than welcome to contact me or even Carla. She is more than welcome. She's happy to assist you with that matter. And I just also want to highlight that this particular grant software or portal is best used with Google Chrome. So if you are using Internet Explorer or Firefox, it may work a little slowly or it may not work at all. So we definitely encourage you to use Google Chrome in order to access the application. Carla, do you have any, I guess, tips or suggestions for folks using Foundant?
I would say if you go in to create a new account, it's going to kind of walk you through the process of trying to set up a new organization. If you get a message that pops up that says your organization EIN is already in the system, reach out to Carla. It'll give you the contact information. Please feel free to reach out to me and I can just get you added to the account so you don't duplicate and create a new account. And of course, that forgot your password links there. So you can utilize that if you think you might be in the system, but you just don't remember your login information. You can utilize that right there on the login page.
Perfect, thank you. Carla is our Foundant expert. So if you have any questions about Foundant, Carla will be that person. I'm trained too, but I'm not as skilled as Carla to help you with Foundant. So, okay, so once you create your account, once you log into Foundant, you will click the apply button at the top to the right. And this was a snapshot prior to another grant opportunity that just became available. So when you do look at this page, there may be two grant process available. So we have our TAL grant application, but also our ACORE grant application. Just be mindful that you are selecting the right grant program and the right grant application. So here you see that we have an apply button as well as a preview button. So if you're actually typing in your responses and you want to submit your application, make sure you have clicked the apply button and not the preview button. The preview button, of course, just allows you to preview the application. I believe you can type in too, but you won't be able to submit the application. So just be mindful of that. And don't be distracted by the enter code. That has nothing to do with our TAL grant program. All right, Carla, do you have questions?
Let's see here. I believe one did come in. Regarding personnel costs, can grant dollars cover 100% of a consultant that may be hired for project planning implementation?
Yes, and we wouldn't necessarily consider that, put that under the personnel. That can be under one of the other categories. So you can reach back out to me, or if you're looking through your application, we have it in parentheses, but we would not consider that personnel. So yes, you can request funding 100% for a consultant if it's for a project.
Great.
Okay. All right. So our TAL grant program I like to believe, and based on a lot of the feedback that we have received, it is a very straightforward, simple process. We're not asking you unnecessary questions. We're trying to get straight to the point, trying to figure out, what do you do in community? What are your needs, and how can we best serve you? So we have updated a few of our questions. So as I mentioned before, one question that we did add was in reference to the social determinants of health. It is a multiple choice question. We're simply asking you to choose which category do you fall under. I would allow you to make that decision. There's no right or wrong answer. So if you do address multiple factors, if you feel like for this particular project you're requesting funding for, if it falls more under education, go for it. But if you do neighborhood and built environment, go for that too. No particular category is going to have favor over the next, so be mindful of that. The next question that we updated a little bit was explain your current challenge that you're facing. We know that many organizations, their challenge is COVID-19. So we just want you to dig a little deeper when you are explaining what this particular climate has done to your organization, or if any new opportunities has come about because of COVID or just in general. We want you to explain that for this particular question, and explain to us how this particular capacity building need will help you achieve greater gains, will help you get to the next level, will just help you advance as an organization. Just in layman's terms, capacity building is getting your organization to the next level. So if some new laptop is going to help you get to the next level, tell us how those new laptops is going to help your organization get to the next level or impact your community at a greater level. And another question that we added was describe the population that your organization serves or the project that you serve. But we want you to keep in mind of health inequities, disparities that stem from structural racism or disenfranchisement or discrimination. So this question in the past was describe your population that you're serving. And in parentheses, we had children, we had elderly folks. And yes, those are vulnerable populations that can also be considered a marginalized population, but we want you to dig a little deeper. So if you are serving children, what disparities does this particular subgroup have? Are they oppressed? Do they live in economically distressed communities? Have they been challenged by the criminal justice system? Whatever the case may be, we want you to dig a little deeper and give more information, and don't just say, we're serving the elderly population. That's great, but not all of these particular subgroups are truly marginalized. So just be mindful of that when you are answering that question. And again, I know this may be new for a lot of folks. So when you are answering that question, and if you do get stuck, I would love to help you think a little bit more about that question and dig a little deeper. All right, so are there any questions, Carla, before I provide a few resources?
We have one last one that came in. It's kind of similar to the other. Can my organization request funding for a consultant to prepare a business plan?
Yep.
Okay.
All right, so I have provided you with three resources. We do have a resource page on our website, so you're more than welcome to get that and do what you need to do with it. But in terms of this particular webinar, I would definitely encourage you to visit the Catholic Health Association website. They do have a lot of information as it pertains to community benefits and social determinants of health. Healthypeople.gov, they are a wealth of resources and information too. As I mentioned before, they are in the process of updating their objectives and their goals for the next decade, but the information there is still relevant and useful. And a new resource that we added was from the American Public Health Association. And I did borrow a lot of content and information as it relates to health inequities and structural racism. So in public health, a lot of organizations are calling it what it is. Racism is a public health issue that we all need to address. So if you want to learn a little bit more about health inequities and disparities and how racism impacts the health system in general, I would definitely encourage you to go to the American Public Health Association to read up on that information. It is very useful. All right, so that concludes this presentation. I hope it was very helpful. I hope I was able to answer any questions. I hope Carla was able to help you out too as you are getting ready to create your account for Foundant. If you have any questions as it relates to a project or a program, or you're just unsure about something, I am available by way of email. We are working remotely, so the best way to contact me is by way of email. I am a millennial, so I am very responsive. I can check my emails on my phone. So if you need me for anything, please reach out to me. And if we need to set up some time to chat over the phone, I'll be more than happy to do that. But for an overview or for more detailed information, please visit our website and our Tile Grant overview page. And again, I should have this webinar posted on our website no later than Monday of next week. All right, so if you have no questions of me, I hope you enjoy the rest of your day, but I will answer the rest of the questions that are in the chat box. Thank you for joining. All right, Carla, what do we have?
We only had one last question about character counts.
Maybe you can answer that question. We'll see.
Yeah, we'll do on the side. Okay.
All right.
So the application, does it have character counts or word limits in it? And yes, and you will be able to see that on the application as you go through. It'll tell you the word counts, and it does include spaces and characters. So just keep that in mind as you're going through the application. But it will count down for you as you are typing into the narrative box.
Thanks for that.
I think that's everything, Brittany. Nope, don't see any other questions.
All right, I look forward to reading all of you guys' applications, and you have, I think, roughly 2 weeks left. So if you need me for anything, please send me an email. And Carla, maybe we can close out if there's some more questions.
All right, thanks so much, Brittany. Thanks everyone for joining us. Have a great day.